So this is that cyst in the bone there. Sometimes it becomes filled with some soft tissue. I'll take a grasper. We'll kind of clean that out a little bit. We don't bone graft the cyst or anything. Taking away the impingement lesion should take care of the source of the pain. Take that soft tissue out of there, but we do see that that cyst there. So here we've removed your impingement lesion. This looks much better here, okay? The cyst has been cleaned out. We've put some nice smooth edges on the sides, so that ought to help that. I'm going to take your hip now and put it through a range of motion here and see if we have got any residual impingement remaining that we need to take care of. I think most of the problem here was on the femoral side and not the acetabular side, but we might have to do a little labral repair on the socket anyway, just because of the injury that you had sort of over time. Looking at your labrum right there, some of the bone behind it. So we're going to bend your hip up here way up and try and get a good look at if you've got any residual impingement. You can see how previously you would have started to engage there, I think. So we're going to bend up a little bit more. Still not getting any impingement here. It looks good. So that looks pretty good, I think. So I'm going to remove a little bit of bone here on the socket side too. Mainly in the area where the cartilage has been damaged a bit from your pincer impingement. And then we'll kind of decide whether we need to do any repairing of your labrum or not. I guess we might have to do a little bit.
Talking about urology, I was thinking, oh God.
So here, I've removed a little bit of the rim of the acetabulum there, basically down to the level where we start to get more normal cartilage. Okay, so the stuff that's left here is firmly attached. Your labrum is detached now. We just need to repair that, and it should take care of things for you. So we start putting in anchors and repairing your labrum. I'll show you how I do that in a little bit. So here we've put in an anchor. Okay, it's got these two stitches coming out and past one underneath the labrum there. Then I think I'm just going to pass it all the way around that labrum. Just like that. Knots on the outside of the hip, and then pull them into the joint. So I'm making my knot on the outside here. Then we put a couple other knots behind that. Back that up to make sure everything's nice and tight. Then we come in with a little arthroscopic knot cutter. And cut our knot, just like that. So here I've repaired your labrum. Okay, removed some of that extra bone there and took care of the cam lesion, the extra bone on the femur. This ought to take care of your problem. I'm pretty confident that you'll be better after this. If you have any questions, give me a call. Otherwise, I'll see you back in clinic. Take care.